We're going to talk about diabetes. And in this introduction class, we'll be talking about diabetes and its predisposing factor, its diagnosis, its types of diabetes, its treatments, complications, and the prevention of complications. This is divided in two sections, Section 1 and Section 2. Well, Section 2 talks about education of diabetes to a diabetic patient, specific, sick day rules, food care, travel and vacation times, during recognition of vascular complications, the psychological and social aspects, lifestyle, and more. In today's class, we are going to talk about the introduction and how diabetes becomes one of the most common chronic complication in our society. So, let's go on. Well, in diabetes, we can see that it's the most common complication. And simply, we can put this as body that cannot process a certain food because the supply and efficiency of hormones such as insulin. Well, as we know, pancreas, which is the most important organ in the body, in a general and a diabetic patient, the process is completely different. In general, a large meal secretes more insulin. While a diabetic patient, it depends on body does not produce insulin or more insulin, but the body does not accept it. That's what I'm going to talk about. While normally a food, when it's digested and broken down, it's going to transport it to different parts of the body. While in diabetic patients, it's mostly different. The key component is carbohydrates. Now, carbohydrates, where can we see? Cereal, starch, rice, wheat, and even fruits. Now you can see here a boy is eating a bread, and once he eats a bread, it's been digested by the enzymes present in the mouth, and then it's taken to the stomach where glucose is produced, and this glucose has been transferred to blood vessels. Now usually when glucose is formed, it's stored in the body in form of glycogen. And once it's needed, it turns into glucose. And that's where the enzyme such as insulin takes place. Insulin regulates the amount of glucose circulating in the body's bloodstream. Now, insulin functions can be divided into four types. First, it regulates the blood sugar level. Second, it helps for glycogen storage, fat synthesis, protein synthesis, and many more. This is our introductory class. Thank you.